We have sad news that we lost 7 people yesterday, so we're reporting 7 deaths today. One is a woman in her 70s who was found in her home. The others were hospitalized. 3 of them came from nursing homes and 3 did not. I want to talk to you about several things today. Tomorrow we will be able to go shopping with Retail to Go. And so let's talk a little bit about Retail to Go, how that works, what you can do, what you can't do. A few examples of the type of retail establishments that will be included are like clothing and department stores, furniture stores, beauty and hair supply stores. All of the Retail to Go's will have to follow those same social distancing rules that are in the order for other retail. And one key point, the stores must limit contact with the customers by allowing people to pay online, and if offering curbside pickup, they place the items in your trunk and they'll wash their hands between each of these interactions with customers so that you'll be kept extra safe. Things that are not included in Retail to Go are touch services like hair salons, where you're actually getting your hair cut, spas, tattoo parlors, and other types of touch services. I'll tell you about one other thing, and then we're going to have one of our kind of hard conversations. Nextdoor, if people are familiar with the Nextdoor app, Nextdoor is partnered with Walmart, so it's now possible for you to go on Nextdoor and find out who's going to Walmart, and then if you're going, you can tell folks you're going and get things for them in the neighborhood. If they're going, they can get things for you, and you just go to nextdoor.com and you'll see a program in the group section for shopping at Walmart and Nextdoor. Today I spoke with more than 30 North Texas Muslim imams from the North Texas Imams Council, which represents the vast majority of mosques in Dallas County. And I wish them a blessed Ramadan as they begin their holy season tonight. So tonight begins Ramadan. It's the holiest 30 days on the Muslim calendar. In consultation with all of them, they expressed consensus that their mosque would remain closed in Ramadan for worship services in order to help flatten the curve. They will continue to try to minister through online services and encourage people to recite their holy book, the Quran, and pray and fast at home. This leads into what I want to talk to you about tonight, which is religious services. You know, they're a great example because the Holy Quran states that to save one's life is like saving all of humanity in the sight of God. And our Muslim community, which has been at the forefront of serving humanity with community service initiatives that they plan to only embrace in their holy season. The imams express that they see keeping the entire Dallas community safe by not taking any risk is part of that service. And so as a community that has faced rising levels of discrimination and bigotry in the form of, among other things, wild conspiracy theories, I'd like to thank them once again for proving to be some of the finest citizens of Dallas, upholding their love for their faith and humanity without contradiction. So there have been changing guidelines on religious services. And the new guidelines from the governor talk about following that churches and houses of worship should follow the CDC guidance, but leave some discretion on the part of churches as to whether they will follow the CDC guidance. And so the orders from Austin have changed, but the CDC guidance and the medical community guidance here in Dallas has not changed. So when we click on the link for the CDC guidance, we would get this page, okay? And that page, just before we get to the meat of it, would say right on the front, if there is substantial spread in the local community, like the over 2,500 people and 7 deaths that we have, 2,500 COVID positives and 7 deaths that we have here today, that would be considered substantial spread. You continue all the steps and all of the things before that, and you cancel all in-person group activities, and you limit access to non-essential visitors to the facility. And this is a guideline for faith-based leaders. When we click on it for more information, it pulls up this document. And all these will be available on our website. And essentially what it says is that the safe thing to do is not to get into congregate group settings at a time when we still have substantial community spread. I'll leave it up to each faith group and each faith leader to determine what they do, and then I'll leave it up to each person who would consider attending a service to consider what they would do. But know that uniformly the medical community here in Dallas County, the Dallas County Emergency Management Department, my office, me, and the Public Health Authority, as well as the CDC, strongly encourages you not to hold congregant worship services and encourages you, if given the opportunity, not to go to those at this time. Let me explain to you why that is, all right? If there is an outbreak in the department store after we have retail to go, all right, that once we find that person, they're tested, they're found to have COVID, the tracing around that to keep the community safe is pretty manageable, right? There's the 3 or 4 people in their section of the department store. There's their family and contacts when they go home. If there's enough of a spread, enough of a contact there, their family might be quarantined or will be quarantined with them. And if there's enough of a contact at the workplace, those folks might have to go into isolation as well. But if 100 of us come together to worship and there's an asymptomatic COVID, that is a person who's not exhibiting symptoms but has COVID and spreads it, you can have a situation like you had in Korea, where at a large church there was one asymptomatic COVID, and that person is largely believed to be kind of the patient zero of their whole outbreak. Or in Tennessee or Alabama, where there were COVID positives, people that didn't know they were sick. They didn't go to church thinking, I'm sick and I might get others sick. They felt fine, but they went to this large group and they got a lot of people sick. Well, what happens when we go to church or when we go to a house of worship, a synagogue, of course we all go, we worship together, and then we go home, right? And so if you're trying to do a tracing, even if it's a relatively small congregate setting where everyone comes together and then goes back to their families, you can see how very quickly it overruns the system. So when we think of the things that are happening, that are giving us more freedom and allowing us to open more of the economy, you've got, so far, you've got car dealership showrooms being opened. You've got, I may leave something out, you've got retail to go. You've got the surgeries, the elective surgeries that are not cosmetic but needed. And you've got hobby stores being opened here in Dallas County for mask supplies. And the governor on Monday is going to give us some examples of some more stores. But if we just take all of those things that are opened, that we just talked about, together they don't pose as much of a concern to the healthcare community as if we all come together for congregate settings all over this county and all over this region. So I would just encourage everyone that's making those decisions. You're now in the unenviable position that some of us have been in for the last few weeks, right? It will fall on you to make a good decision. And the last thing I want to say about that before we talk about something else is it's very important, and you have been so good to me. You have exhibited so much grace towards me. When you didn't agree with my decisions as a community, you've exhibited grace towards me, and you've understood that people are doing their best. We're doing our best to keep you safe. Well, that's true of the people that are going to make decisions on this, whether to have services, whether to follow the CDC guidelines and the local health recommendations and not have services. And then it's also true of the people who decide whether to go to services. And so undoubtedly, not everyone will choose the same path. We need to exhibit grace towards each other, especially people who don't agree with us on that issue. You're going to see more and more of this, unfortunately, as this moves on. You're going to see things that are allowed that the medical science and the CDC says are not a good idea, okay? And so when we have that happen, I'll come to you and we'll have these what I call hard conversations where I'm just giving you the truth and the facts, okay? And then you're going to be left in a decision where you're going to have to decide what to do with that. So when medical science says one thing and the law says something else, remember, it doesn't mean that you have to disregard medical science. It means that you can disregard medical science. But it's our strongest recommendation to you that you don't disregard medical science. I'm going to turn it over to Phil to answer some things or tell you some things, and we'll take a couple of questions and be done.
So today we have 80 positive new cases reported. Total count now is 2,763. The judge mentioned the 7 additional deaths that we reported today, so we have a total of 72 deaths in Dallas County. In the county jail, we've got a total of 118 now inmates who've been confirmed positive. Also, 10 jail employees have been positive. In the homeless shelter, we have total 41 persons from Dallas Life that have tested positive. In long-term care facilities, we have Presbyterian Village North, 8 residents or staff members, 0 deaths. Madison on Marsh, 1 resident, 0 deaths. Avenues of Park Forest, 7 residents, 0 deaths. Duncanville Health and Rehab, 27 residents or staff and 0 deaths. Winters Park Nursing and Rehab, 2 residents or staff and 1 death. Brentwood Place 2, 12 residents or staff and 1 death. Villages of Dallas, 1 resident, no deaths. St. Joseph Village, 1 resident, no deaths. Brentwood Place 1, 77 residents or staff and 6 deaths. The Reserve at Richardson, 14 residents, 2 deaths. Edgemere Luxury Living, 11 residents or staff and 4 deaths. And Skyline Nursing Facility, 51 residents or staff, 3 deaths. And Monticello West, 32 residents or staff and 9 deaths. Just as a graphic to show where we are again in comparison to some of the other communities across the country. Do we have that slide? So again, these are the 10 largest counties, including New York City. This is the updated graph. Again, New York City is starting to level off, but it's way higher than all of the other 9 largest counties in the country. I'll blow up just those other 9 on the next slide. And you can see then, so the remaining counties still Cook, Los Angeles, a little worrisome how that is moving up on Los Angeles, Miami-Dade, Harris is the next, and then Dallas, we're down in this bottom part in terms of the 9 largest counties, or remaining largest counties. Next slide. This is actually just for the Dallas metro area, but to show how our curve has, on that side? Okay. How our curve in terms of doubling times over the time compared to many other communities. If we'd have kept going, doubling cases every day, would have continued on this trajectory every 2 days, every 3 days. And you can see, again, that flattening of the curve in terms of drawing out that doubling time. So now even every week, doubling every week to every 2 weeks. And again, that's the whole Dallas metro area. And similar chart for the number of deaths in terms of doubling counts of those and how that has flattened off and slowed that doubling time. So those are all good signs. But, again, the message still is what's scary about these is how quickly they can take off. And like when you saw New York, it was just a month ago that we were about at the same level, and then their numbers just exploded. So, these things can change very quickly, and that's why, it's important to see what the effects of everyone's sacrifice is, but that how we still need to be careful as everything progresses. So, thanks.
Before I take your questions, I forgot to mention that today is our first day of our Parkland mobile testing units going out into nursing homes and healthcare deserts and taking the test directly to the people. These are federal tests. We'll do a little under 300 of those today. With that, I'll take your questions. Anybody have a question?
Hey, Judge, this isn't the first time an elderly person is found dead at home. Has that brought up any concerns as to, are people not going to the hospital, these persons that maybe don't have family, or are we looking into that to see how we can help and prevent that?
The question was, it's not the first time an elderly person's been found dead at their home, and for that matter, it's not the first time a not elderly person has been found dead at their home. So yes, we are looking, for ways to look into that. It's a bigger problem. It illustrates what happens when 20% of the people who work for a living in your county, working age people who also happen to have jobs or did before this, don't have health insurance, right? They're not going to see their primary care physician when they're sick. They're toughing it out. And when this disease gets into the lower lungs, right, for healthy people, the underlying condition, there's a better chance it stays in the upper respiratory system. But when it gets low, it leads to, rapidly declining health. And so, Phil, do you want to add anything as to what we're doing to try to do well checks on people, or?
Again, it
Sure.
shows, well, not really much to add, just it's a big problem.
Yeah. Any other? Yes, sir.
On retail to go, is there anything that you'll be doing from an education enforcement effort tomorrow in terms of making sure that businesses know what the guidelines are, they should be putting it in the trunk of the car, etc. Our public health crew is going to be going around to businesses tomorrow just to make sure that they're following the rules.
So that might be a Phil question because it's Dallas County Health and Human Services health inspectors. You want to take that?
Sure.
So, and actually was in the morning news this morning, some of our staff that are going out in the community that are trying to make sure educating the vendors, the retail outlets, and the citizens regarding what are the best practices, making sure that people are educated about these all these practices and the messages. So definitely we've been trying to target some of the zip codes that have some of the highest numbers of cases, and so try to get that education and knowledge about what practices should be implemented. So,
Hey, Judge, I know you gave a long explanation on the church. Are you basically leaving it up to the church leaders to decide on how they're going to continue with their services, or how's that going to work?
So the question was, what's the current state of whose decision it is as to what happens with churches? So the governor has come in and superseded local orders and taken away the ability of the local government to say you must follow the CDC guidelines. What he's done is he said you should follow the CDC guidelines, but and you should do several things in his order, but at no time does he say you must do anything, right? And so what we want people to know, both our faith leaders and the people who would go out for services. And I happen to be a person who my family and I go to church every Sunday, and we go on some days that aren't Sundays sometimes. And so I understand for people that that's an important part of many of our lives. But what we want the public to know is that the CDC guideline for places like us with significant community spread has not changed. It says don't do it. The recommendation from our hospitals, from our health department, from me, from my office, from our emergency management department has not changed. It says it's not safe to do it. There's not a safe way to have a large congregate setting in the midst of a peaking substantial spread. Having said that, these decisions will now rest on the shoulders of many. And so it's an unenviable position to be in. Trust me, I know the feeling better than most of what that's like. And so it's important, just as you have shown grace to me, that people out there who disagree with the decision of someone show grace to them, right? Because we're not all going to agree. The point that what we have to do to keep you safe and frankly just to sleep at night is to be able to tell you what the facts are, what the truth is. And the truth is the CDC guidelines and the local health guidelines have not changed.
Have you heard any reports of any faith leaders that are planning to hold services this weekend?
I haven't. Every faith leader that I've talked to thus far has told me that they personally or their denomination will not hold those. But they've also said that they've heard of others that would, that they're, like for instance, in large, you might have a loose affiliate of smaller churches that are non-denominational, and they might have some that would choose to do that. And so we'll just have to see. I know many of the larger denominations, like I know all the, well, I better not say anything because I kind of know where some of them already are. But as far as I know, they'll roll out what they're doing, but that won't cover every worship service, obviously, in Dallas County. And I want the people in North Texas to know this too, all right? Particularly if you're in one of the four big counties, the CDC guidelines, you have a substantial outbreak, right? And so that hasn't changed. The order didn't change because the CDC changed their guidance. The CDC guidance is the same. I don't know about the individuals in your county as to what those doctors are saying. I can tell you what all the doctors with the health systems, many of which go into your county because these are big health systems, are saying, and what we're saying. And people just need to know what the facts are as they make their decisions, right? So that's what we're saying on that. Any last question before we wrap up?
I have one question.
Yes, ma'am.
With the retail stores opening, and I mean, I understand it's, they put the produce or whatnot in the trunks or in their cars. With that being said, you're still going to have people being out on the street, maybe some asymptomatic people who are going to be out and about. Do you guys have an action plan as far as if the numbers start going up again? Are you guys going to close down stores? What's your plan if that happens?
So the question is, what's the action plan if the numbers go up? Would we consider closing down stores, these sort of things? So that's the importance of testing. We need more testing. The state and the county are working together to get more testing. It's really, we need to get that from the federal government. We hadn't had the success that we need on that. But if you're able to have testing, then you can find out that the outbreak is in XYZ mall, okay? And then you can do things to find out where in XYZ mall it is and how do I isolate the people who are sick and what's prudent. And many times, businesses are pretty on the ball about this. So if there was a big outbreak at a certain department store, they might choose on their own to suspend service for a few days. But that's why the testing is important, and it's also why it's important to do this hopefully in chunks, right? Because if you look at what every paper and every consultant that's looking at this in the country, including the Trump administration, are saying is, don't do a few every other day. Do them in sections, then test around that section. See if the numbers go up or stay stationary, then do another section. If we do it kind of haphazardly, where it's every few days, the problem is when you do have that spike, and particularly at a time when we have no testing, or we have some testing, but we don't have enough testing, it's going to be very, very difficult to isolate which of these, 10 things we did over a 2-week period were it. Whereas if you do them all together, it's a little bit easier for the tracers to figure it out.
One more question, maybe
okay.
for the doctor. The last graph that he was showing of the number of cases and the curve, is that telling us that we're still on track to end this on time as you guys have been projecting, maybe by the beginning of...
I mean, it shows the effect of what the order and the stay home, stay safe has had. It slowed the curve. It slowed down the doubling time for both the deaths and for the number of new cases. But, as following up what the judge was saying, we are monitoring all these things. We continue to monitor. We just had a meeting today with all the different groups in the community that are working on modeling, with the different universities, with UT Southwestern, hospitals, looking at what the models are showing. And so we are monitoring those numbers. Some of the things we'll look at is also the number of hospitalizations, as well as ICU, hospitalizations. There are some things that are fluctuating a little bit now, and that we're monitoring. We're starting to see, perhaps there was a slight uptick in some hospitalizations in the last couple of days, and we're trying to monitor that and see, and just keep on top of that, and as some of these things open up, that's what we need to watch very closely to make sure that it doesn't get above these thresholds that overwhelm our system.
Thank you all. I'm going to turn it over to Jason. Do this in Spanish. Thank you, everyone. Please stay safe. God bless you all.
I'm still. Oh, you're switching? Okay. ¿Lo vas a hacer tú en español?
Sí.
¿Sí? Ok.
¿Quién está ahí que pueda escuchar el chip? Ahora vamos a hablar en español. Para que me corte un sonido de